Well, like the rest of this year's Charing Cross program, the Peripheral Arterial program is going to focus on optimum pathways of care. Whether one should intervene at all, and if one decides to intervene, when should that occur, what is the best method of intervention and what's the evidence behind that, and following intervention, what are the best surveillance modalities that we should be considering. So it should be an interesting program. Well, as you'd expect with Charing Cross, there's plenty of peripheral arterial disease scheduled throughout the program. The main peripheral arterial session is actually the full day session on the first day, the Tuesday, full of interesting topics we'll discuss shortly. On the second day, there is both the pre-recorded live cases or edited live cases, as well as live cases coming from several sites. Should be fascinating experience. And then on the third day, we'll be holding the Alegex critical limb ischemic session again this year, as well as some profit papers. So a jam-packed session for peripheral arterial disease. On the first day of the Charing Cross Symposium, in the main peripheral session, there's going to be a focus on acute and chronic ischemia. We're going to dive very deep on the subject of drug-coated balloons, and there's going to be headline first presentations on a number of applications of drug-coated balloons in severe calcification, for example, in longer lesions greater than 15 centimetres, and in more complex lesions, task C and D lesions. We're also going to hear the very first presentation of a new drug-coated balloon for the superficial femoral artery, so it should be jam-packed with of interest. And of course there'll be some information on head-to-head comparisons of the various drug-coated balloons. Well, as discussing drug-coated balloons in depth at Charing Cross, there'll certainly be in-depth discussion of the use of stents, particularly in the femoral-popliteal artery. There'll be some discussion on a number of the features of stents, such as the radioresistive force and flexibility of stents. We'll also discuss whether we should be combining stents with drug-coated balloons and the role of stents in heavily calcified arteries. And once again, we're going to get a first presentation of 12-month data from a new self-expanding stent. Well, we'll then move anatomic regions to the popliteal artery and discuss whether there is a role for an endovascular approach to popliteal artery aneurysm disease. We'll then switch below the knee, and we'll once again revisit the idea of whether the angiosome concept has any validity. We'll again look at the multidisciplinary approach to below-the-knee disease, and we'll hear first results from below-the-knee registry. Finally, on the first day, the diabetic foot session will again focus on the need for a multidisciplinary approach to the diabetic foot, and also the importance of urgent revascularization, the need for very rapid revascularization in these patients. The second day is full of both live and edited live cases. There'll be live cases initially coming from Leipzig, which will focus on below-the-knee intervention, and then we'll move to the Munster site, where we'll see more intervention, primarily in the femoro-popliteal segment. And throughout the edited live cases, we'll see the use of drug-coated balloons, stents, and stent grafts. So it should be a fascinating live and edited live case session. And finally, on the third day, the Alegex program will focus on critical limb ischemia, and again the need for multidisciplinary input. There'll again be a review of evidence of treatments such as balloon angioplasty, and in particular drug-coated balloon angioplasty. So I think you can see that over 3 days there's a comprehensive coverage of the most important aspects of peripheral intervention, as well as some very important new trial evidence being presented and discussed. I look forward to seeing you there.